Hi, my name is Dr. Najera, also known as Dr. Dallas, and today I'm here with Amber, and we're going to be doing a preoperative video. Now that you've scheduled surgery, we want to give you the best possible experience, so we have a list of things that we're going to share with you to get you ready for your upcoming surgery.
Okay, so it's 3 months before my surgery date. What do I need to know?
Well, for our out-of-town patients, you got to start thinking about making travel arrangements to come here to Dallas, to our area. So making sure that you make those arrangements and that the person who's going to help you out is also available and comes with you for the surgery.
Yes, it's very important to have a great support system, either friends or family, to help you while you recover for surgery.
Exactly. So whether it's husband, sister, whoever might be helping you, it's really important to have that support system because you're going to be pretty much down that first few days.
Yes.
So it's really good to have someone who's going to help you bring that water, help you go to the bathroom, change your dressings, because all those things are really important. And people may underestimate the impact of this surgery and how it impacts the body and how you might need that help. So that support system is really important.
Especially being a mom, and if you have children, you want to make sure that you have a great support system or a sitter to help you with your kids.
And also you got to take time off of work. So you got to put that paperwork in because it might be 2, 3, 4 weeks before you can get back to work.
It's also important prior to surgery that you're living a healthy lifestyle.
That's right. You have to exercise, you have to eat right. Remember to keep your BMI less than 30 because if you have surgery and you're doing all these things, you're going to heal better and your recovery is going to be that much better.
Yes. Okay, so it's 1 month before my surgery date. What do I need to do to be prepared?
So we're almost there. So we're going to ask you to get medical clearance, blood work. We want to make sure if you have other medical problems that you have a primary or your regular doctor says it's okay, that you're safe for surgery. We also check your lab work, make sure everything looks normal. And then we also, if there's any imaging like x-rays or a mammogram, we want those done beforehand to make sure everything looks normal so we know when you're in surgery, we have a safe surgery and give you the best possible results.
We also asked you to stop smoking prior to surgery.
That's a big one. So we don't want you to be smoking at least 6 weeks before and 6 weeks afterwards. If you're smoking, that can really cause problems with wound healing, infections, and really ultimately affect your long-term results. So that's a big one. We want you to stop smoking and hopefully quit smoking in the long term as well.
Yes, and when we say smoking, we mean no nicotine at all. So no vaping, chewing tobacco, no smoking of any kind prior to surgery.
Exactly. All those things can impede wound healing, cause increased chances of infection. So everything that has nicotine or vaping or smoke, those all affect your results afterwards. Now it's 3 weeks before surgery, you're almost there. I want to make sure your blood work looks normal, your medical clearance is okay, because if there's anything that's abnormal, we can repeat those labs or have your medical doctor see you again. And then once that's all cleared, they're going to come in and see the patient coordinator.
Yes, and at that appointment, we're going to go over pre-op, post-op instructions, have you sign a consent for surgery, take your pre-op photos, and also go over all financial information prior to surgery. So prior to surgery, we ask that you send our patient coordinator your wish photos.
I think wish photos are really important because it helps me as a surgeon really identify what our patient wants to look like. And oftentimes we can get really close to that picture, but we always tell our patients we can't replicate exactly what that picture looks like. So if it's really big or really small, whether it's a breast or buttock that we're talking about, it gives me an idea whether we can achieve that for her, or this is too much, too big, and we have to back down a little bit so everyone's on the same page. We want to deliver the best results, and that means everyone being on the same page so we understand what I can do, and more importantly, what I can't do.
Yes.
Now it's 2 days before surgery. Hopefully you're getting really excited, although people can feel a little bit nervous, which is totally normal, but there's a few things beforehand that our patient coordinator is going to contact you about.
Yes, so our patient coordinator will call you 2 days prior to surgery just to answer any last minute questions, as well as calling your prescriptions into your pharmacy. So you want to make sure that you have all your prescriptions ready for the day of your surgery. Another important thing to remember prior to surgery will be no dark nail polish. So you can use gel or dip powder. We just don't want you to use any kind of dark color. So purple, black, gray, no dark nail polish the morning of surgery, as well as no makeup. So no lotion, you don't want to wear any kind of jewelry, just loose fitting, comfortable clothes the morning of surgery. As well, the morning of surgery, you want to make sure that you have all your medication here prior to surgery.
We also have a private waiting room for our patients' families that they can wait there. They can get coffee, watch TV, but we also have a list of places that they can get lunch or breakfast nearby, return back to our VIP waiting room, and also get information and updates on their family members who are in surgery. So it's the night before surgery. Our anesthesiologist is going to contact you. Also, we want to make sure that you get a good night's rest.
Yes, also nothing to eat or drink after midnight. That includes water. But stay excited. Tomorrow is your surgery.
So on the day of surgery, what can our patients expect?
So you're going to want to arrive to our surgery center a little early that morning. We have VIP parking. You'll come on in, meet with our nurse, our CRNA, and then they'll meet with you.
That's right. So I'll make our markings. So if we're doing a tummy tuck, liposuction, breast surgery, we want to make sure all that looks good. Once I'm done with the markings, we're ready to head back to the operating room.
Yes, in the morning of surgery, you want to make sure that you wear comfortable clothes. Something loose fitting, easy to put on and off. As well as if you are having a tummy tuck, we recommend that you wear bikini or underwear bottom that you would prefer your incision to be below.
So after surgery, you're going to come to our recovery bay, and nurses are going to be watching you until you're ready to go home. For our bigger surgeries, we're going to have you stay overnight, and then you can go home the following day. And so for our out-of-town patients, we ask them to stay in the area between 7 and 10 days. So if they need anything, they can always see us before they travel back to their home state, whether in a car or by plane, but we're available for those first few days when they're here in town. So now surgery's done, and there are a few things that everybody can expect after surgery. One of them being is swelling and bruising.
Yes, so after surgery, you are going to be bruised and swollen. You might even look a little bit bigger prior to surgery. That can take about 4 to 6 months to get better.
That's right, so you have to be patient, and if you have a big wedding or something planned, don't schedule the surgery 1 week before this. Give yourself some time. If you're getting ready for the summer, make sure you have a few months before the summer activities so the swelling can go down and the bruising can go away. So after surgery, everybody experiences some form of pain or discomfort, so we give medications to help manage this pain and discomfort after surgery.
Yes, and if you have any concerns, questions, or reactions to any of the medications, give our office a call and we'd be happy to help you.
So after surgery, you can expect some form of numbness that might occur in the areas that we did surgery. Usually this improves with time and can take up to a year in certain areas.
As well as itching. So after surgery, as the swelling goes down, your skin might be a little itchy. We recommend using vitamin E oil just to kind of help minimize any of the itchiness.
So after surgery, we ask all our patients not to lift anything heavier than about 15 pounds, no strenuous activity. That also includes intercourse. At 1 week, you're going to see our physician assistant, and there she's going to assess how everything looks, how the incisions look, remove some of the garments, replace any dressings, and also importantly, if there's any drains, she's going to look at the drains and see if they're ready to come out. So when the drains are removed, you're then cleared to have lymphatic massage, which is a specialized type of massage to kind of help some of the fluid and swelling to go down a little bit quicker. So after that, you're going to see me at 1 month, 3 months, and at 6 months to make sure everything's looking good, swelling's improving, bruising has gone away, and make sure that we deliver the results that you really wanted.
Thank you for watching this video. If you have any additional questions, please feel free to contact our office.
And we're so excited that you've chosen us to be a part of your journey. We can't wait to see you.